Good morning. Today we are going to talk about joint replacements. So generally replacement are nothing but replacing damaged or diseased portion of the body by means of processes. It is a surgical procedure. Today we are going to say about different types of joint replacements. First is total hip processes. Second, partial hip processes. Third, total knee replacement. Partial knee replacement. Ankle replacement. Shoulder replacement. Elbow replacement. Wrist replacement. Generally, so this is the head of the bone and this is going to be fit inside a socket. If you are going to replace a bone, so this is the humeral head, this is the acetabulum. So usually the biomaterials which we are going to replace must be made up of metals. The material should be able to accept by the body. The material should be biocompatible, tissue compatible, blood compatible, non-toxic and non-carcinogenic. That is, it should not contain any harmful substances. It should not cause any allergy conditions or should not trigger the other tissues. Does not cause any allergy conditions or does not produce any side effects. In total hip replacement, the entire humeral head or the femoral head and the acetabulum is replaced. So, in between the humeral head and the acetabulum, a polymer material is present. A biomaterial made up of polymer is present between the two joints for easy articulation. The biomaterial present between between the two heads is essential for lubrication. In partial hip replacement, only the femoral head is replaced and the acetabulum remains intact. That is, only the femoral head, which is made up of metal or either ceramics, to be replaced and the acetabulum is not disturbed. In total knee replacement, the entire knee, both the tibia and tibia and femur bones are replaced and the patella is inserted, where the patella acts as a pin to join the two bones. To join these two bones, a patella is being fixed to join the two bones, which acts as a hinge. Normally, two types of joints are encouraged. They are hinge joints and socket joints. The shoulder and hip joints are composed of socket joints, ball and socket joints, and the knee joint is composed of hinge joints. Next, coming to partial knee replacement, is also called as unicompartmental. Partial knee replacement is also called as unicompartmental, where only the diseased or the damaged portion of the knee is replaced. Not the entire knee replacement is not recommended or advised, only where the damaged portion of the knee is replaced by another bone on another biocompatible material. So the replacing biocompatible material may be ceramic or any metal items. The metal items should be non-corrosive. It should not react with the body fluids. The metals commonly employed are stainless steel, titanium based alloys and chromium based alloys. Next is ankle replacement. Ankle replacement comprises replacing of the entire tibia bones, femur bones. Next is shoulder replacement. In shoulder replacement, replacing the gliding bones and the humeral bone. Gliding bones and the humeral bones. Next, Next is elbow replacement. In elbow replacement, it comprises, this replacement is very rare. The material which we are going to replace should mimic the natural material. It should absorb all the nutrients and should be able to perform the should be able to perform the activities of the natural materials, natural tissues and natural organs. Next is wrist replacement. Wrist replacement consists of many small carpal bones where many bones are placed in the wrist. So, if the wrist bones are damaged, it is very difficult to replace the wrist bones because it comprises of many small carpal bones. Usually in wrist bones replacement, if the wrist bones are damaged or any injury occurs, the many carpal bones are replaced by means of plates or wires, where the bones are tied by means of stretchable wires. These wires are usually made up of polymeric materials, and the plates are usually made up of titanium based alloys or silica cobalt based alloys or SS, and it is usually employed with screws and nuts. Now, here the two bones are held together by means of a synovial fluid which acts as a lubricant. The synovial fluid are covered by the synovial membrane. So, a polymeric material is placed between these two bones. So, usually hard tissue replacement are done by using metals or ceramics, and soft tissue replacement are done by using polymeric materials because the polymers can be molded into any shape and can be easily fabricated. The soft tissue replacement consists of polymers. Here the role of this cartilaginous membrane is to act as a lubricant. It is usually made up of polysaccharide material. It is usually made up of a polysaccharide material. It helps in a lubrication. So, the material replaced must replace the original functions of the body, should not cause any allergic conditions to the surrounding tissues, should be easily healing, and should not produce any side effects to the patients.